Enter at TaylorvilleDailyNews.com.
To learn more about Rolling Meadows Senior Living in Taylorville and the apartments they have available, click on their icon at TaylorvilleDailyNews.com.
WTIM. Good morning, Central Illinois, and welcome to the WTIM Morning Show on your information station. The show is sponsored by People's Bank and Trust, where they put people first. I'm your host, Reed Kamai, and we get things started today with the folks at Springfield Clinic, Taylorville, and my guest this morning is Elysse O'Brien. Elysse is a registered nurse at their walk-in clinic and is actually soon to be a nurse practitioner at that same walk-in clinic. Elysse, welcome in this morning.
Thank you. Good morning.
Yes, good morning to you as well. So let's get things started with this. Just tell us a little about yourself.
Okay, so I graduated Taylorville High School in 2016. After that, I went to Milligan University, where I obtained my bachelor's in nursing in 2020. And then from there, I worked as a nurse. And then in 2023, I started St. John's College of Nursing, their BSN to DNP program. So I actually just completed that in May of this year. And then, so with my nursing experience, I have over 10 years of nursing experience. I worked here locally in Taylorville's ER as a nurse, and then I worked at Memorial for a little bit, and then I've been with Springfield Clinic for the past 4 years. Okay, so yeah, keeping it really local in terms of the Taylorville locations for both of those places. And of course, it's right down the road from the high school that you went to, and that's only a half hour away from Milligan University. So yeah, really keeping things local, at least for the most part. And it sounds like you care for patients of all ages. Is that right? Yes. So I care for anywhere from infants all the way to elderly individuals.
Okay. All right. So wide range there is what you're working with. So you are in the walk-in clinic that we've heard a lot about through the other folks at Springfield Clinic who have come on here. Just tell our listeners about that walk-in clinic for those who are not as aware of it.
So Taylorville's walk-in clinic, we are open Monday through Friday, 8 to 8. And then also on Saturdays, we are open from 8 to noon. Typically on the Saturdays, we have scheduled appointments, but also availability to have walk-in appointments too. Okay, so, and I know the Saturday
aspect of that is a little bit newer. So, and it sounds like that's just to kind of help, add a little more time, handle the traffic.
Yes. So it's nice to have availability on the weekends when actual clinics are closed. I know patients really appreciate that availability on the Saturdays.
Yeah, and it makes a difference, right? Because, health doesn't, operate, Monday to Friday.
No.
It operates all the time, of course. So then you want to have that in there as well. So, and it's timely to have the opening. It's timely to be, talking about it because, we've got school starting back up and with it flu season.
Yes, we are definitely approaching flu season, which is why another reason why I'm going to be working at Springfield Clinic in Taylorville is I'm basically going to start to be just an additional provider to help with the overflow that we have during flu season.
Yeah. So, and you folks, we're looking to, add to the staffing numbers, and they're doing that through you indeed. So that is certainly going to be, I'm sure, convenient for a lot of folks in the community. We'll talk more about flu season as we get on a little bit later in the show. But yeah, you folks at Springfield Clinic, Taylorville, walk-in clinic, certainly trying to make, that quick care convenient. Talk about how it is you folks do it at Springfield Clinic, Taylorville in the walk-in.
So in the walk-in clinic, they don't have to have an appointment necessary. We just really go on walk-in basis. So first come, first serve. The walk-in clinic is just a great option for after work medical care. So those needing care in the evening hours between 5 and 8 p.m. You don't necessarily have to have a primary there at Springfield Clinic. We're open to see any patients that present to the clinic. And then, but if the primary is with Springfield Clinic, then we can help coordinate follow-up care. So if the patient is a Dr. McClintock patient, then we can work on getting the patient scheduled for a follow-up visit if needed. And then also, I wanted to say that our providers at Springfield Clinic are all accepting new patients. So that would be Dr. Kink and Dr. DeLuca with pediatrics. And then you have internal medicine with Dr. Gill, And then also Dr. McClintock's team and family practice are all accepting new patients. And then with the walk-in clinic, we do accept most insurance providers. And then just really walk-in clinic, a good thing that we have is just easy registration upon arrival. So when you walk into the clinic, they're in the main entrance. There's a registration desk. That is where patients present to get registered. And then our walk-in clinic is just there to the left. And then what we really try to do is have minimal wait times. So we really don't want our patients waiting for a long time, because then you're just filling up the waiting room with sick patients, and that doesn't make anybody comfortable. So yeah, we're just really lucky to have the walk-in clinic right here in town, and we're just thankful that we can serve our community.
Yeah, and it's such an important service, to be able to provide all of that for the folks who need it in that instance, and making it easy as well, because I would imagine it can sometimes be the difference between getting the care and not getting the care. And that's obviously a big thing. I know you mentioned, being able to follow up with the primary care providers who are there, which I'm sure is pretty easy, right? You probably put the information into the software and then they find out right away. How would someone who has primary care outside of Springfield Clinic, Taylorville, get the follow-up information, to their provider in that case?
So unfortunately, a lot of our electronic health records aren't the same. And so with that, really, we would just express to their patients that they would have to make the follow-up appointment. So unfortunately, I wish they all had the same medical record, but a lot of them don't. So it just makes it a little difficult. But really, we just tell our patients if they feel like they need to follow up with their provider, then they can.
Okay. Yeah. So, and there are a lot of different providers and electronic health record software systems out there. So that makes sense. So so in that situation, would you folks maybe print out the information and then they have it?
Yes.
So then, fax it?
We could do that if we need to.
Okay, perfect. So then you have it for the patient, it sounds like. So yeah, seems like you folks have that worked out. And in terms of patients who go into the walk-in clinic, what types of patients do you see?
So we see patients of all ages. We can see infants up to elderly individuals. Mostly in the walk-in clinic, we just see those acute sick visits. So if you have cold and flu symptoms, cough and congestion, sinus infection, ear infection, sore throat, fever, minor injuries, or if you have ankle sprains, wrist sprains, we do have the availability to do lab services. So if it is during clinic hours, they could go over to lab and get blood work, or also in the clinic, we can do rapid testing for flu, COVID, strep, and RSV if needed. We do not do full physical exam. We don't do we don't do school physicals, and we also don't do any medication refills or any workman's comp cases. Those are all actual primary care provider.
Okay. Yeah. So yeah, for those appointments, which hopefully folks have done by this point, then you would you'd want to see the PCP. But yeah, with the other ones you mentioned, sounds like there's a lot that you will certainly take a look at for patients in the walk-in clinic. All of that, and I'm sure that'll come in handy, like you mentioned, as the flu season approaches, because I would imagine, right, you probably want to go and see if what you have is the flu or if it's just a common cold, right?
Yes, yeah. It's especially if you just had symptoms for a couple of days, but you have something going on this weekend. A lot of patients just really want to make sure that they're okay to be around other people and so on and so forth, because we definitely don't want to get other people sick if we can prevent it.
Yeah, that's a big part of it in what you folks do at Springfield Clinic, Taylorville. Now, you folks also have some partnerships with other providers and other areas of Springfield Clinic. Talk about some of those partnerships and how you make it all work.
Yes. So with Springfield Clinic being so close to the Taylorville Memorial Hospital, if we feel needed, then we can have patients go over to the emergency room. So if it's something that we're not quite comfortable to care for or don't have the capabilities to care for in the walk-in clinic, then we can just call over to the ER. We do have a nice relationship with them. And then with myself working there before, I still have some connections, which is nice. And then, so if a patient is orthopedic, then Springfield does have Springfield Clinic Orthopedic in Springfield. They do have a walk-in clinic, so we could also coordinate care there. And then also, like I mentioned kind of previously earlier, we do have lab and radiology services through Springfield Clinic. And then if it is after hours, like I said, we could send them over to Taylorville Memorial Hospital.
Okay. So yeah, sounds like you have connections there through TMH, through the other specialties, or at least the orthopedic specialty with Springfield Clinic. And I don't think I knew they had a walk-in at the orthopedic location in Springfield. So good to know there. Anything else to mention about those partnerships before we move on?
I would just say we're just really thankful that we can coordinate the care that patients need if we can't meet it there in the walk-in clinic. Yeah,
no, and I imagine that could be important too, because in other cases, they don't have partnerships, and then it's a lot more difficult then to get the care. So good to note there. I'm talking right now with Elysse O'Brien, a registered nurse at Springfield Clinic, Taylorville's walk-in clinic. Let's take a break, and when we come back, we're going to talk all about flu season because, well, we know that one is coming up indeed, and that'll be right here on the WTIM Morning Show on your information station.
Your information station, WTIM.
Digital marketing has its place, but across rural America, there's still one medium that farmers and ranchers consistently rely on: ag radio. Farm broadcasters reach agricultural producers where cellular service drops and internet connections fail. When farmers are making critical decisions in the field, they're listening to farm broadcasters they've trusted for years. Consider this: the average farmer spends 5 to 6 hours daily in equipment where radio is their primary companion. That's why ag radio offers agricultural advertisers unparalleled access to decision makers exactly when they're thinking about their operations. Farm broadcasters don't just deliver your message, they enhance it with credibility built through years of providing accurate weather forecast, market updates, agricultural news. National Association of Farm Broadcasting research reveals that messages delivered by trusted farm broadcasters result in 30% higher brand recall and significantly improved conversion rates compared to digital agricultural advertising. Ready to reach farmers where digital can't? Visit IllinoisFarmRadio.com and put the power of ag radio to work for your brand.
Find out all the great things happening in the Pana area on the WTIM Pana Morning Show, Tuesdays from 8:40 till 10. You'll hear interviews with Pana area community, nonprofit, and business leaders each week. The WTIM Pana Morning Show is brought to you by these sponsors:
Pizza Man, Noren's Hardware, Bob Riding's Pana, and Okanee Chop Shop.
Carl Krumsick here from Krumsick Monument Company in Taylorville, Illinois. Find out the many services we provide by clicking our icon on the obituaries page of TaylorvilleDailyNews.com.
This is Blaine Cornwell with Prairie State Insurance. To learn more about our products and services, click our icon on TaylorvilleDailyNews.com.
Swings, and it's a high fly ball. That's hit deep. It's a gunner! It's a gunner! And a game winner!
It's a Sunday made for the kids. On August 30th, when the Cards take on the Pirates, bring the whole family out for Kids Sunday. Enjoy Team Fredbird, free ice cream thanks to Prairie Farms, and more family fun. Plus, kids 12 and under will take home a Cardinals growth chart, courtesy of Missouri Farmers Care. A keepsake your family will treasure for years to come. Get your tickets now at cardinals.com/promotions.
At People's Bank and Trust, they help their consumer and business customers spend their time living their life, not explaining it. At People's Bank and Trust, they put people first. Find out how they can help you by clicking their banner ad at TaylorvilleDailyNews.com.
Hi, this is Jeff Robinson from Advanced Title. Whether selling your home on your own or through your local realtor, please give us a call at 824-8007 for all your title work needs.
WTIM. We're back on the WTIM Morning Show on your information station, and the show is sponsored by People's Bank and Trust, where they put people first. I'm your host, Reed Kamai, and I've been talking with Elysse O'Brien, a registered nurse at Springfield Clinic, Taylorville's walk-in clinic, and this is quite a timely time to have you on the show with talking about the walk-in clinic, because school has just started, and that means flu season is coming. And first off, around what time do you folks typically see, like what time of the year do you typically see kind of the peak in infections and people coming in?
I would say roughly like September, October, all the way through April would be whenever we start to see a decline, which is really nice because here the Springfield Clinic here in Taylorville is actually hosting an upcoming flu clinic. So we will have flu shot clinics. I believe they are September 26th and October 24th here in Taylorville. And those will be from 8 a.m. to 11 a.m. Once we have more information on that, we will get that out there to the public. But yeah, I definitely think that as students go back to school, we start to see an increase in sickness. Like kiddos tend to share germs pretty easily. And then they not only share it amongst themselves, but also the staff in schools. So then we also get those patients. But like I said earlier, I will be the additional provider to allow patient coverage during this upcoming flu season. So it'll just help like take off the burden of like primary care providers that can't necessarily get patients in. It'll just be nice to help take care of the other patients that need quick care that we can provide in the walk-in clinic. And like I said earlier, we do rapid testing available. So like if patients need tested for flu or COVID, or if they have a sore throat and feel like they need to get strep, or if they've been exposed to strep, or then also we can do RSV testing for children that need it too. So yeah, I'm just really fortunate that I can help care for patients locally as I have been doing throughout my career. It's nice to see that impact that you can make on patients' lives, and it's nice when they present and then you can help them feel better. That's all we want.
No, that's a big part, I'm sure, of going into medicine and into nursing and all of that. That's what it's all about. So. So yeah, you have the flu shot clinic dates. You'll announce that as we get a little closer, and all of that. How have you noticed the flu numbers from what you know at Springfield Clinic or in your time overall in nursing? How have you seen flu numbers kind of fluctuate in the last, say, 5 years or so?
I mean, honestly, I would definitely say that they are on a rise. I know we try to express that patients get the flu shot because we do think that will at least minimize their symptoms, if not minimize the amount of time that they have symptoms. So that helps. Unfortunately, it's not like 100%. But yeah, I would definitely say the rates of flu are rising. But we really try to when patients are sick, we just try to make sure that they stay hydrated, symptom management with Tylenol, ibuprofen if they can take it, and just really try to rest, take it easy. And I mean, none of us like to be sick, but we try to just make sure patients can get to feeling a little bit better.
Yeah, and that's what it's all about. And I imagine in a town like Taylorville, right? Like you have kids in the schools, they spread germs. The adults in the schools can get it as well, right? Then they come home, and then that can infect everyone else here. And there's a lot of in-person work that happens here. So yeah, I mean, I would imagine there's a pretty high rate of spread at the peak times of the year. I know you mentioned it seems like it's a long time frame that you get those high flu rates, and then I'm sure also, right, when you get into the cold months, people are inside more. Does it go up even further there?
Yes, because it is nice when people are sick or when sickness is around, and the heat and the sun tends to keep it at bay a little bit. But yeah, when people are inside, or if they're having local gatherings, then that can, because we say around holiday season, a lot of people get sicker too, because then you just have those big family gatherings, and then you happen to spread it because you might not know that you're already sick. So yeah, I would say definitely winter time is when we see an uptake in any illness, really.
Okay, so that'll be something to watch out for, and I'm sure it'll keep you folks busy, although hopefully a little bit less busy now that you're there.
Hopefully.
So that I'm sure is the aim in that. So yeah, about 30 seconds to go. So your rapid testing sounds like flu, COVID-19, strep, and RSV. Those are kind of your big four. All right. Yep. So that rapid testing is available at Springfield Clinic, Taylorville, and Yeah, and that's where it is. Elysse O'Brien, a registered nurse at Springfield Clinic, Taylorville's walk-in clinic. Elysse, thanks for coming on.
Thank you. I appreciate it.
Yes, and thank you for listening here on the WTIM Morning Show on your information station. Stay tuned. We'll be back in 10 minutes with another conversation.
The Big 870 WTIM Assumption Taylorville. 96.1 FM Taylorville. 107.5 FM Shelbyville. 107.9 FM Pena Nokomis.
Breaking news this hour from Town Hall.